Randy Einstein. I thank you for watching this video today. I would like to take this time to inform you a little bit about epilepsy. At the tender age of 8 years old, I learned about epilepsy. I was watching TV with my mother and I fell asleep. Suddenly I was awake and I was in the next room. My parents were panicked and called 911. I had no recollection of what happened or how I got there. I remember taking a ride in my first ambulance. It was very exciting. It was late on a rainy night, and I wore my favorite footsie pajamas with my Care Bear sneakers. They were adorable. At the time, I had no idea what epilepsy was, but my life was forever changed. I'd like to take the next few minutes to share with you some information about epilepsy. I will outline the characteristics of the disorder, inform you about diagnosis, signs, and symptoms, treatments, and prognosis. Epilepsy is also known as seizure disorder. It's a neurological disorder that's characterized by the tendency to have repeated seizures. Episodes of disturbed brain function cause changes in the person's attention or behavior. According to the Epilepsy Foundation, about 2.2 million Americans are affected by epilepsy. Seizures are characterized by abnormal signals in the electrical activity in the brain. This causes disruption in the typical processes of the brain. There are several different types of epilepsy and seizures. The first type that I would like to discuss with you are petit mal seizures. Those are actually the tiny seizures. They are partial seizures that affect only certain parts of the brain and may not even affect parts of the body very severely. There are generalized or clonic-tonic seizures. Those affect the entire brain, and they are where the person can fall down and have really bad convulsions or fits, and they also may not remember what happened. These are the types of seizures that I personally suffered from. My entire body would convulse violently, and I remember back then, which it was in the 80s, they were also called grand mal seizures. There are several early warning signs that indicate that there is a seizure that could be impending for the people who have epilepsy. One of them is called an aura, and basically that is just a sensation or a feeling that person has that warns them that maybe a seizure could possibly happen. It could include feelings of deja vu, strange smells, tastes, or sounds, and a loss of vision or blurring of the person's vision. Other pre-symptoms of an impending seizure could include fear, dizziness, headache, nausea, fever, panic, or numbness. Personally, I always had a feeling. I would get really scared as a child because I would feel like, okay, I'm going to have a seizure. And usually I did. So I had a fear of falling asleep because of that. There are several treatments that are available for people who have seizure disorder. The most common treatment that people use is medication. Personally, I used something called Tegretol, which is a very common medication to use for epilepsy. It prevents the reoccurrence of seizures by calming the electrical activity in the brain. It also can make you tired, so it's difficult to do schoolwork sometimes if you're on one of these medications. Another treatment that I've heard of is called a ketogenic diet, which is a diet that's high in fat, which can also calm the electrical activity in the brain and help the person not to have a seizure. One treatment that I thought was really interesting is something called art therapy. It's a treatment that is used to reduce stress in the patient and to manage any negative feelings that they may have about their seizure disorder. So I would like to thank you very much for the opportunity to share this information with you. I think it's important that everyone understand exactly what they're dealing with epilepsy. I hope I've sufficiently informed you on the disorder, including the definition, diagnosis, and treatment, as the disorder is very common. I just wanted to also let you know that there is hope for remission from the disorder. Many people, including myself, eventually find a way to control it. Personally, I've been seizure-free for over 20 years, minus medication. And like me, over 70% of people are able to go into remission and to lead a normal, healthy life. Thank you.